Breast cancer has been around for ages. Its presence has shadowed mankind at every stage of human existence. This is a very short representation of the history of breast cancer and the varying amounts of success man has had at controlling this disease. The background, incidentally, is a photo-stitched panoramic image of the Himalayas taken from Dochula Pass in Bhutan. The first documented evidence of breast cancer treatment dates way back to 1600 BC and is found in ancient Egyptian papyruses. These papyruses tell us of a variety of treatments that were tried by the Egyptians. They include cauterization of the tumors, which involved attempting to fulgurate them using heat and very crude surgical instruments. In 460 BC, Hipocrates, considered by many to be the father of modern-day medicine, was convinced that the disease was caused by an imbalance of body fluids leading to an excess of what he termed black bile. His opinion of cancer was pretty straightforward. Once a diagnosis of cancer is made, the disease is incurable. Later in 200 BC, Galen, another Greek and a disciple of Hippocrates, echoed the sentiments of his guru, both on the origin and its end result. Though he did try a number of remedies including licorice, opium and castor oil, the cure rates expectedly remained dismal. The 17th and 18th century saw a bunch of interesting theories on the etiology of breast cancer, most of them coming out of Europe. These put the blame on a wide variety of factors, including increased acidity of the breast lymphatics, mixing of lymphatics with glandular and nervous tissue, and social causes like childlessness, sedentary lifestyle, and mental disorders. One of the more bizarre theories for the etiology of breast cancer came from Bernardino Ramazzini. This Italian researcher suggested that the higher incidence of breast cancer in nuns was directly due to a lack of sexual intercourse. It is said that too much of a good thing can also be bad, and Prussian-born Friedrich Hoffmann postulated that an excess of vigorous sex could also increase the risk of developing breast cancer. On a more serious note, towards the end of the 18th century, physicians began to consider the use of surgery. And by the mid-19th century, it became an established form of treatment for breast cancer. This was helped by rapid advances in the field of surgery, anesthesia, sterility, and infection control. William Stewart Halsted, an American surgeon, performed the first radical mastectomy in the US way back in 1882. This included surgical removal of the entire breast, including the skin over it, and the chest muscles, and the regional lymph nodes. And although similar operations were performed in Europe in the preceding decades, Halsted is the one credited for popularizing this surgery. As a direct consequence of Halsted's mastectomy, for the first time ever, the cure rate of breast cancer jumped from 0% to close to 50%. Halsted's mastectomy was to become the mainstay of breast cancer treatment for the next 100 years. During this period, there were a few other interesting things that bear mentioning. In 1895, for instance, a Scotsman, George Beatson, discovered that blocking the production of estrogen had a beneficial effect on breast cancer, and he recommended the surgical removal of the ovaries as an optional form of treatment. In the absence of functioning ovaries, estrogen is also produced in the adrenal glands, and removal of the adrenals was added to the surgical options for breast cancer, as was removal of the pituitary glands for the very same reason. It is interesting that these same principles will be applied much further down this fascinating timeline, but this time around by using far less morbid techniques. If the radical mastectomy of Halsted's was not radical enough, in the mid-20th century, Urban tried to improve breast cancer survival with an even more radical procedure, the extended radical mastectomy. Sadly for these patients, the unacceptably high morbidity was not associated with a corresponding survival advantage, and the procedure was quickly abandoned. The middle of the 20th century saw two dramatic changes in the approach to breast cancer. First was the realization that breast cancer had to be treated as a systemic disease, which meant that the body had to be treated as a whole instead of concentrating solely on the breast and the regional lymph nodes. And secondly, the necessity for radical debilitating surgery was being seriously questioned. Simultaneous progress in the development of anti-cancer drugs and medical oncology led to the introduction of chemotherapy and later hormonal therapy in the management of breast cancer. With this, cure rates that were staggering around the 50% mark that was achieved in the Halstidian area over a century ago now suddenly began to stir again and show further improvement. Less morbid modifications to Halsted's radical mastectomy, known as the modified radical mastectomy, began to surface somewhere in the 1970s. Hearteningly, these were found to be equally effective in terms of cure rate when compared to the radical surgery. In the early 1990s, breast conservative surgery in the form of a lumpectomy with axillary clearance became an acceptable surgical option for early breast cancer. This was used in conjunction with radiotherapy to control local recurrences. No longer was it considered mandatory to remove the entire breast. The widespread use of mammography and subsequent rise in its detection of very early lesions contributed significantly to this trend. If this timeline appears to spike over the 20th century, then the 21st century threatens to see it go through the roof. Paradigm shifts in prognostication and staging, increasingly sophisticated diagnostic and biopsy techniques, novel ultra-conservative surgical alternatives, and individual tumor-specific treatment modalities are but a few of the promising options on the horizon as we finally begin to gain some control against a disease that has plagued mankind ever since the very beginning of time. Thank you.